Type 2 diabetes and diseases of the heart and blood vessels are among the most frequent causes of morbidity and mortality around the world. Underlying these two common conditions is a lesser known disease, insulin resistance, about which there's still a lot to be learned. Let us examine this elusive disease together. Insulin is a hormone that was discovered in 1921 by Frederick G. Banting and Charles H. Best at the University of Toronto. It was later purified in 1923 and since that time has been used to treat insulin deficient diseases such as type 1 and type 2 diabetes. Insulin is secreted by the pancreas in response to proteins and sugars eaten during a meal. Insulin stimulates the uptake of glucose into muscle and fat cells, generates protein and glycogen in the liver and muscle, and causes the storage of fat in fat tissue and the liver. It also inhibits the breakdown of proteins and fats into sugars. Aside from these actions, insulin is also involved in tissue growth and development and promotes bone formation. By acting on the brain, insulin tightly controls food intake in humans and suppresses both the sensation of hunger and liver sugar production. This system can become disrupted by the overconsumption of food, a process that leads to the buildup of fat in several organs, including the subcutaneous tissue, the intra-abdominal tissue, the muscles, the liver, the heart, and the blood vessels. This impairs the function of insulin and leads to insulin resistance and chronic low-grade inflammation. In rodents, just a few days of high-fat feeding is sufficient to cause the buildup of fat in the liver and insulin resistance. Skeletal muscle insulin resistance requires at least several weeks to develop. In humans, just a single bolus of fat taken by mouth is sufficient to increase liver fatty acid buildup and decrease the sensitivity of the liver to insulin. Because insulin is no longer able to promote the uptake of sugar into the cells and perform its other functions, the body compensates by producing even more insulin, leading to a higher than normal level of insulin in the blood, a state known as hyperinsulinemia. Eventually, the cells of the pancreas burn out, and the inadequate supply of insulin coupled with the insulin resistance existing in the tissues leads to elevated blood sugars and overt type 2 diabetes. Since the resistance of the tissues to insulin involves a wide range of organs, insulin resistance is frequently accompanied by a constellation of risk factors, including high blood pressure, abnormal fats in the blood, poor blood sugar control leading to diabetes, as well as buildup of fat in the abdominal cavity. The abnormal fats in the circulation lead to disease of the heart and the blood vessels, causing a condition known as cardiovascular disease. This process is not completely understood, but eating too much and living a sedentary lifestyle is a leading risk factor for insulin resistance. We sometimes refer to the collection of risk factors that accompany insulin resistance as the insulin resistance syndrome, the metabolic syndrome, or syndrome X, which put people at increased risk for type 2 diabetes and cardiovascular disease. Because insulin resistance predates diabetes and its complications by many years, it is beneficial to screen people for insulin resistance early and to treat insulin resistance in the hope of either delaying or preventing the onset of diabetes and cardiovascular disease. There is evidence that blood pressure is linked to insulin resistance. Exactly how insulin resistance influences blood pressure, however, remains a hotly debated topic. The susceptibility of developing metabolic syndrome or insulin resistance depends on age as well as on other genetic and environmental factors. Strangely enough, some people who are not obese can be insulin resistant and have abnormal cardiovascular risk factors. Although there are many definitions for metabolic syndrome, almost all of the metabolic abnormalities include central obesity, high blood cholesterol, reduced HDL cholesterol levels, high blood pressure, and elevated serum triglyceride levels, with insulin resistance as a possible common cause. The combination of high serum triglycerides, reduced HDL cholesterol levels, and elevated small dense LDL particles is commonly called dyslipidemia. The metabolic syndrome is associated with an approximate doubling of cardiovascular risk and a five-fold increase in risk for type 2 diabetes. Researchers believe that the most important cause of insulin resistance is a high-fat, high-refined carbohydrate diet and physical inactivity, which is made worse by genetic traits such as the development of abdominal obesity. Risk factors for insulin resistance include being overweight or obese, age over 45 or older, a strong family history of diabetes, being of African American, Alaskan Native, American Indian, Asian American, Hispanic, Native Hawaiian, or Pacific Islander American ethnicity, physical inactivity, high blood pressure and abnormal cholesterol levels, history of diabetes during pregnancy, a history of heart disease or stroke, and polycystic ovarian syndrome. It is believed obesity, that is a BMI greater than 30, especially too much fat in the abdomen and around the organs called visceral fat, is a primary cause of insulin resistance. In clinical practice, there is no single laboratory test that is used to diagnose insulin resistance syndrome. Diagnosis is based on clinical findings corroborated by laboratory tests such as fasting insulin levels, the oral glucose tolerance test, or by examining lipid profiles. Some of the signs of insulin resistance include a waistline of over 40 inches in men and 35 inches in women, blood pressure readings of over 130, 80 or higher, fasting glucose levels of over 100 milligrams per deciliter, a fasting triglyceride level of over 150 milligrams per deciliter, skin tags on the body, or patches of dark velvety skin, that is, a condition known as acanthosis nigricans. There is still no definitive proof that insulin resistance causes the components of metabolic syndrome, and there is currently no sound evidence showing that the treatment of insulin resistance reduces morbidity and mortality. The underlying cause of obesity-related insulin resistance is the over-intake of food. It is now well recognized that obesity is a chronic inflammatory state that alters the way the body handles fats and sugars. How inflammation may cause insulin resistance in various tissues and in type 2 diabetes remains an area of active investigation. Lifestyle modification through eating a healthy diet and getting exercise should be the first steps in preventing and treating insulin resistance and metabolic syndrome. Insulin sensitivity improves within days of calorie restriction, even before significant weight loss has occurred. Nevertheless, at present, there is a continued misconception that weight loss is required for benefit, whereas weight loss simply improves on the benefits gained from a healthy diet and exercise. The amount of dietary fiber one eats is inversely related to insulin levels. This may explain the lower incidence of high blood pressure, high blood cholesterol, and cardiovascular disease in people with high fiber diets. A diet rich in natural sources of fiber such as whole grains and vegetables can help to reduce insulin resistance. Along with dietary modifications, aerobic training has been shown to be beneficial in treating insulin resistance, as did resistance training, and bodybuilders have shown similar glucose control to long-distance runners. As far as medications go, although we are unable to explain all the actions of metformin, It is active at all sites of impaired insulin action and has been used as a first-line drug to improve insulin resistance for decades, although this is an off-label use. I hope this video sheds some light on insulin resistance and the steps you can take to prevent the onset of this condition. If you found the video useful, like and share the video with friends and family, and don't forget to subscribe to the channel so we can continue to bring you useful videos on important medical topics. Until the next video, eat a healthy diet and get lots of exercise. Thanks for watching.